Hi, everybody, and welcome back to Cat's Track. We post an interview with an amazing Canadian each weekday for your daily inspiration. Today, I would like to introduce you to my friend, Rick Trimp. Rick was born and raised in Montana. He has a lovely wife and two strapping boys, one in Regina and the other in Portland. Besides his family, he's very passionate about spending time with them, and he also loves fly fishing on rivers and streams. In fact, this afternoon, he's going to the Bow River. As a proud U.S. Navy veteran, he believes that it is important to support our military communities, active duty, reserve, guard, veterans, and their families. And you will find his full bio attached. Rick, thank you so much for joining us today.
My pleasure, and thank you for having me, Catherine.
Oh, of course. I love the work that you guys are doing. And it's been nice to meet you finally after all these years.
It's a pleasure. Likewise. Yeah.
Are you ready for the questions that we sent you?
You bet.
Awesome. Okay. So the first one's usually the toughest one to talk about, but what has truly been some of the worst things that you've had to deal with in the last few months?
In the last few months, it's really caused our organization to have a relook at as to how we deliver our services and how we make a greatest impact in the community. The COVID pandemic has really created significance in the mental health arena, and so we have resources out in our communities, such as suicide prevention lifelines that people reach out to when they're in distress. And within a couple of weeks, we saw a lot of our lifelines out there were actually incurring about a 300% increase in their volumes.
Wow.
And so it's a significant mental health impact of this pandemic, with people feeling isolated, with people having a high degree of uncertainty about their jobs, about their ability to pay for their housing, for example, to how do they work with their kids now they're at home and don't have school, and all those added pressures have really increased an awareness for us and an impact on our organization, and has made us actually really buckle down and to find alternative ways to deliver our programs and services and introduce fairly new programs such as our online program, LivingWorks Start. So it's been really challenging, but it's with every challenge comes opportunity. And for LivingWorks, it's been an opportunity to reinvent ourselves, to look at how do we deliver in a world of electronic medium and still preserving our face-to-face training when that comes back, but being able to offer to our communities of people alternative ways to learn about how they can care for one another, about how they can develop skills in this field of suicide prevention, and how important it is to be out there watching over your loved ones, your neighbors, and really being a community leader in your community to make sure that people are watched over and people in crisis get the help that they need.
Very good. Yeah, you're doing some good work. How many people per day would you be impacting or supporting?
Well, we have, on average, we have nearly 1 million people that we can reach per year. We have, we've seen significant growth, and that's why I kind of hesitated a little bit about how much we're impacting. Because over this COVID time period, we've seen significant response from existing customers and also new customers that really have reached out and have needed our services. And so we have a training community, a group of trainers across the globe that's about 8,000 people strong. And we have a number of customers, and from different industries, different categories of customers, whether they be military customers across the globe, veterans communities across the globe, school systems, health systems, fire, police, EMS, university systems. And so we actually operate in pretty well every sector of our community. Yeah.
Well, thank you so much for your work in this area. It's so important, especially right now.
Absolutely. And I think one of the things that's really important to highlight, Catherine, is that we're all in this together. we're all in this pandemic together, and we're all feeling the crunch. And we have families and friends that we just need to watch over, and we need to get the skills to be able to learn what to look for and how to respond effectively to that. And I think one of the things that's really important in this field is that because it's such a significant issue. Suicide is in Canada, and I'll speak specifically to Canada, where we have 11 deaths per day in Canada from suicide. And so, if you want to extrapolate that out, a little bit over 4,000 people per year. And every one of those deaths has a huge impact on people's loved ones in their community, within their sports groups, within their school systems, within their workplaces. This is a significant issue that really bears an importance placed on it by our decision makers, by our governments, and as we look at going through a time where we're coming through this pandemic, and I have a background in emergency management, so disaster preparedness, disaster response, and disaster recovery, and some of the evidence. A lot of the evidence there really points to the importance of looking after our mental health. And so it's typically 3 to 6 months after that incident is that when people start to realize the impact that they've had on them. And so if we can get our communities of people trained and get resources in place and make sure that people, we have a number of resources, but it's ability to connect people to their resources so that when we see an individual who's in distress, that we know how to connect them to those resources, how to ask the right questions, how to show that you care, so that those people can stay safe. And that's really what we're focused on as an organization, is communities of people, and trying to really educate that community or those individuals, and then draw connections within community. And so, just for an example on some of the impact that we're having, I'll use one military base as an example. This is a military base down in the U.S., and it's a special operations military base. And so these people are highly trained individuals, and a military base in the U.S. can range anywhere from 20,000 people to over 150,000 people, and they're massive. But this one military base is one of the smaller ones on that scale, but still they were having 9, 10 suicides per year. And these are special operators, they invest a lot in these people, and they're very important. They work in small teams. And so they reached out to us and they said, what can we do? And it was really the leader of that organization that said, enough's enough. We have to do something. And so what we did is we came in with our programs and services. And for the first year and a half, they didn't have any more suicides. And so over the past 3 years, we've been able to reduce that suicide rate by greater than 80%.
Wow.
Yeah, and so it's sustainable. And it's I use the example of CPR. And in our communities, it's important. We all know it's important to have CPR training, because if somebody is suffering from a heart attack, we know what to do. We know how to keep them alive until those additional resources can come in and take on that individual's care. The same thing goes for suicide prevention, is that anybody can learn skills, and we have a number of different roles, and they're complementary skills within a system. So we have multiple resources. I mentioned health lines. We have emergency departments, we have emergency responders, but we have to look at it as a system. And so the individuals that we teach are the equivalent of CPR. So it's an individual that can identify, an individual who can actually respond, when that person's in crisis, can keep that person alive until that next level of care can come in. And so, we work with, another example is the California school systems. And so the California school systems, 3 million students, 750,000 staff. It's a massive system. And so we're implementing what we call our network of safety with the California school systems. So our network of safety is made up of all those skills that I just mentioned. So we have training for different roles, and we have trainings for those school students to be able to identify amongst their peers, either by text or by, in person, could be by email, and so we teach them the skills to identify, hey, something's not right here with my friend, and what do I do? And so then they connect them to that next level of care, and so eventually you have this connectedness amongst your community. And so an organization like the California school systems, militaries, health systems, we're all part of a community here, and so really important for us to get these roles and to get these skills.
Yeah, very good. What does someone, if someone is in crisis right now and is hearing this and is considering death by suicide, what's something that you would say to them from a piece of advice?
A piece of advice is that if you're feeling stressed, if you're feeling worried, please take the time to just call someone. It could be a friend. It could be, if you feel that you can talk to a friend about this, that's great. I really encourage people to call the 800 hotline, the suicide prevention hotline that we have nationally here in Canada. And they have skills that they can, so they've taken our training. Our training is the standard for suicide prevention hotlines to be able to handle somebody in crisis, to be able to walk them through, to be able to develop a safety plan is what we call it. So it's how do we connect the resources that you need to keep you safe for now as you walk through this journey. And it's a journey, and people, it's not abnormal. It's not abnormal to have thoughts of suicide. As we walk through life, we get faced with multiple challenges, and sometimes those challenges become overwhelming. But there's hope. There's the ability to reach out and to get the help that you need, and to keep people safe, and to keep safe yourself. But it is a journey. It's not a quick fix. It's not going down, to the emergency department and hoping everything's fixed and being able to walk away. This is a journey, and it's reestablishing that hope. And so I want to talk about that helpline again. I quickly talked about the 800 number, but the number is 1-833-456-4566. Or you can text 45645, and we'll say this again, Catherine, if that's okay, towards the end, so that people know where they can reach out to.
Of course.
Great.
Yeah. Thank you, Rick.
Absolutely.
And the 3 things that you'd like to share with everyone today?
I think, and maybe some of this is restating because I kind of jumped ahead on some of your questions.
It's okay, or just, it doesn't have to be 3 things, whatever you want to discuss.
But that's okay. One piece for me is that you don't have to be a professional to help someone stay safe from suicide. You can be part of a system, just like that CPR example I used. You can play a specific role, even if it's just general awareness and being able to identify somebody to stay safe. And anyone can learn to recognize when someone's struggling to help keep them safe. If you sense that something's wrong, it's important to ask directly about the possibility of suicide. You're not going to put the idea in somebody's head. People will be very happy that you asked, because you're showing that you care. And so it's really important to say, are you thinking about killing yourself? Are you thinking of dying by suicide? Do you have a plan? And even if suicide isn't the issue, you can start a conversation that can help someone address some of their other problems. And it's a conversation starter, but it's a really important starter because once again, it shows people that you care. So LivingWorks training is designed to build comfort in asking that question and to help you feel ready. So developing a skill set. So it's more than awareness, it's actually a skill. And so once again, that analogy between CPR and what we do, it's one thing to know the letter CPR and what that stands for, but it's another thing to be able to put your hands down and to be able to do compressions and to have that confidence about the number of compressions that you're doing. Very similar in suicide prevention is that there's very unique skills that we teach and that can actually help keep a person safe. The second thing that's really important, more than ever, it's important to check on people and to make sure that that you're checking on your community. So our families, our friends, our co-workers, our neighbors, we're going through this all together, and the study's shown it's taking a toll on many, many people. I mentioned the rates on our helplines have gone up significantly. The number of employers that have called us and asked for help, the number of respective organizations that are in this field that have called and said, hey, our community's in crisis, can you guys help? And we're seeing a number of reports, and we're overwhelmed with the amount of news that's going on. So it's really important, to be able to check in on our neighbors, our family members, our friends, and make sure that they're okay. So when we reach out and if you see something that's wrong, please follow up, and please make sure that that person gets the help that they need. And back to communication doesn't have to be in person. You can check in by text, you can check in by phone, you can holler across the street at your neighbor who's doing his landscaping or whatever. But it's really important to keep that connection. And that's one of the things in this pandemic is that it's created this isolation or this separation. And we as people, we need that connection. We need to be connected with our friends, our families. Seems like years ago we were all able to go out and go for supper at a really nice restaurant, or we were able to meet and play hockey together, or to play basketball together, and that sense of camaraderie, that sense of having people around you has really changed. And so it's really important to overcome and to find other ways to socially connect again, because it's really important for our mental health.
I agree.
The third thing that I wanted to mention is to our employers and our policymakers. Now is the time to think about mental health. And I mentioned earlier that typically after a disaster or some sort of a major incident, it's 3 to 6 months before we actually start to see the real significant impact. We believe, and evidence supports us, that if we get the skills that we need into our workplaces, if we get the skills we need into our communities, we can significantly mitigate the impact of this crisis. So how long it takes for people to catch up to things. That's how long it takes for people to catch up with things. 3 to 6 months, because they start seeing the bills come in, or they start seeing, their employment arrangement has changed. They're starting to see, how am I going to deal with my kid or my child, I should say, that needs to go back to school, but it's totally different, and I have to change some things in my life. And so some of these things can become overwhelming, and it's a matter of making sure that that policymakers are actually paying attention to this significant issue. It's important not to assume that we can address suicide prevention by focusing only on mental health in a general fashion, only by awareness. And it's specific skills that are needed in order to address this issue. Suicide is unique, and it's a complex problem. and we need specific measures to address it. We need specific measures and action from our policymakers. And I'll use an example of Australia, where they announced a national strategy last year. And with that strategy was the importance of systems to be able to come together and create a umbrella type arrangement where systems of services could be used and shown to actually address the issue of suicide. And so we're a major part in that. We work with primary care networks in Australia. We work with the government in Australia. We work with major employers in Australia. And what a significant difference it makes when we actually have systems that come together and work with organizations and with non-government organizations, private organizations, and government organizations all alike to really address a specific problem. That's a challenge in Canada right now.
Why?
It's because things are very disconnected in Canada. We have a suicide prevention framework nationally, but there's very little action and very little funding to go with that. Provincially, it's the same thing. It's disconnected. In Alberta, there's disconnects. And going back to my comment about mental health and mental health awareness and only focusing on acute care, when we need to be focusing on early prevention, early skills into our community that enable that acute care arena to see the right types of patients so that you actually create a community response to this issue. Because what happens when that person's discharged from our acute care facilities? They come back into the community.
Sure.
If the community's not ready to support them,
no,
you're going to have that recidivism, and or the person will lose hope. And so really important that we focus on the individual and we focus on how we as a community can surround that individual to help them regain their hope and to grow that hope so that they become an individual who helps others. And that's really what we're about and what we're focusing on. Suicide prevention's been this organization's sole focus for over 35 years. It's our passion, it's our expertise, and we're seen globally as global leaders and as global contributors. And it's really important for us as an organization to stay focused on the issue of suicide prevention. And so that's what we've done over 35 years. Our founders are amazing individuals that started from the University of Calgary as an idea and then grew this organization into something that the world recognizes as the leading organization for quality, for evidence-based programming, and for the ability to develop communities of people to have the skills to be able to address this very important issue. So those were my 3 points.
I want this for Canada as well. What is the call to action? How can we support this to happen?
I think the call to action is to actually have our decision makers pay attention to this very important issue. There's over 4,000 Canadians a year that lose their life to suicide. And it's in multiples of people that think seriously about suicide. And so, you extrapolate that and you think about the number of people on a daily basis that under what we would term as normal conditions. But now we're in a pandemic where we know that this crisis is impacting individuals' health. And so we need to lobby our leaders. We need to lobby those decision makers to pay attention to this very important issue. We need a national strategy, but linked with that strategy is a funded action plan. It's one thing to have a framework and to have a bunch of committees do work, but it's another thing to have an action plan that our communities really feel that they're getting something as a result of a government approach.
Mm-hmm.
And that's a missing piece right now. It takes organizations like ours to to work with private organizations, corporations, for example. We do work with government organizations to deliver our programs and services, but those shouldn't be two different items. Those should be part of a system. And we need the ability to have this discussion nationally, and it needs to be a national agenda item for our premiers across the country and our prime minister. It has to be talked about. It has to be considered as we come out of this pandemic.
Our government leaders made the decisions to react to COVID in the way that they did here in Alberta and in Canada and across the provinces. It is my concern that their decision is now creating a ripple effect to what we will now see as PTSD from the decision that they made with all of the people that we know. And it's affected all of us in different ways. I appreciate what you said at the beginning where we're all in the same boat. Unfortunately, I don't think we are. I think that, unfortunately, there's people like you and I that have been blessed to have community around us, but there's many that don't. Many prior to COVID were coming to me to get consulting advice because they're new to the country, they don't have any family or friends. Those people are living somewhere by themselves without a job. I can't even imagine after all these months what they must be going through. So I hear you. I think that it's important that the government is involved, and because of their decision to do the things that they did, I think that they should be leaning in on this and listen to what it is that you're saying and learn more about LivingWorks and meet you and talk to you about a plan. You're doing something similar to what you've been doing in Australia. We deserve that here.
Absolutely, and I want to address a really important fact. It was the Public Health Agency, regularly reports as part of the legislation requirement. So the Public Health Agency of Canada has to report on the number of suicide deaths and the attempts and things like that. It's not only our immigrant population that are struggling right now, but it's also our Canadian-born citizens as well.
For sure.
And even before pandemic, the rate for Canadian-born people was 3 times higher than immigrants to Canada.
Wow.
And people, there's a lot of myths and stigma associated with suicide. They think, well, it's this group or it's that group, but it's really people in the highest income quartile.
Yeah.
It's people in the lowest income quartile. It's young kids as really, really young ages that are taking their lives, and so it goes through the entire age groups. It's not just focused on one group.
No, I know.
And so it's so it's really important to have a strategy for everybody who lives in Canada.
Yeah.
It's really important, and I couldn't agree with you more, is that there's been decisions made, and there's continues to be decisions made affecting the livelihood, the social connections of people. There's multiple conflicting evidence sources out there about the impact of COVID on populations. There's a lot of confusion, and the news, is within our news networks isn't giving us the full story either. And so we have, we as citizens have to kind of sift and sort that information ourselves and try to figure out what is truth.
That's right.
And so that's why I'm really saying we have to watch out for one another. We have to take care of our families. We have to take care of our friends, our coworkers, our neighbors, and step up and be a leader.
I agree.
And so, and it doesn't matter what walk of life you are. And please do that.
I agree. What a great message, Rick. Thank you.
Thank you.
What is your final close? Is there a good news or legacy story or anything you'd like to share before we're finished?
Well, as I mentioned earlier, the good news story is that we're really seeing employers and we're seeing leaders in various countries across the globe step up and say, enough's enough, and they're seeing the future. They're seeing that they need to take action now to prevent um, an increase in the number of suicides within their particular organizations, within their own peer groups, or whatever you might, whatever group that you're talking about. And so, education leaders in California, what a great thing for them to stand up and to work with their political party. And they had a champion there that said, enough's enough, and we have to do something. They funded the initiative, and here's a Calgary-based company that's working in California, right? And what are we doing in Alberta?
Again, a profit from afar, right?
Right. And so really important, for our decision makers to hear this message.
I agree.
And to see what's going on across the rest of the globe. And it's a challenge to them. And that's my challenge to them, is to start thinking about this. And same thing with my public health colleagues, is to start thinking about the impact of COVID, and think about the 2013 flood, about how we went through the response, but then the recovery is really where it needed to happen, where we talked about the psychosocial response, right? Yeah. And so, going back to your question, for a long time, the suicide prevention field has been trying to find an approach that works, even as rates stay flat or have increased. But we've seen results, and with our approach in developing community, engaging community, and skilling up communities. And I mentioned a couple of examples. Another example is a fire department. And so we came in, gave them the skills and training that they needed, and their mental health benefits claims dropped over $750,000.
Wow.
Right? And so there's an ability here to invest in prevention programming that actually gives you that return on investment. And I don't mean that only from a financial perspective, but it helps people become stronger. They become more resilient, and they actually become leaders in their community. What makes this possible is when everyone feels that they can do something about suicide. And that's my key message here, is that everyone has a role to play, and we have a training for every one of those roles. And when everybody feels confident and when everybody feels empowered, that's when you see these life-changing results. So LivingWorks is designed to help bring this to communities on a very large scale. And we can do it also on a small scale. It could be a sports team, right? But it's really about that human connection and that human support. And any of us can help achieve that right now amid the pandemic. We have training online, so you don't need to get into a classroom, right? We have plans, and we have seen organizations actually limit their class sizes based on what their public health guidance is, so they can have that face-to-face training, because they see this as important. Yeah. And they're still in adherence to their public health guidelines, but they know they need to have this training. Yeah. And it's my hope that COVID-19 occasions us to think more about our mental health and the people close to us and how we can be there for them, because that's where we'll save lives. It's about that connection. I
agree, Rick. Thank you so much. Wise, wisdom, all of it. I love it. Thank you for sharing all that with us today. It's been an important message to hear. Thank you.
Absolutely. Thank you for your time.
Of course. That was our dear friend, Rick Trimp with LivingWorks. Please look them up, spread the good word, and let's get everybody trained to be aware of how we can ensure that there's no more suicide. That's a big BHAG goal. That's my goal. Anyway, thanks for joining us today, and we'll see you next time.